Crossing Barbara's border, so over the dry fields of my homeland, and coming into Joburg, Santon swimming pools and the Soweto shacks, airports and railway stations, stranded with a rucksack and guitar. The languages and the places change, and the sky has different stars. And I may be walking in the streets of a city called Amsterdam, with the dust on my boots and the rhythm of my feet and my heartbeat say Africa. And I may be walking in the streets of a city called London, with the dust on my boots and the rhythm of my feet and my heartbeat say Africa. Say Africa, say Africa, say Africa, say Africa.
I'm a road nurse working here in this Stolen Hospital. Well, I'm sure I'm plus minus 20 years now working here. Otherwise, the hospital was small then, but now it is already developed. But our problem has been that we've been short of staff, short of doctors. That now, otherwise the doctors, at least we haven't got, but though I'm not quite sure whether they are going to stay or going to go away again. But all the same, I should think that, well, at least at the moment, we have got few.
Over the last decade, the department has made a lot of strides.
This is the theatre. You can have a look. The machinery is modern as you can get it in a rural area. Very competitive, comparable to other places.
Beautiful.
It's beautiful.
We have built many clinics and have improved many of our hospitals.
These are good beds, huh?
They're modernized. Yeah. Modernized beds.
But no resuscitation for the babies?
No, I ordered it last year, it didn't come till now.
Nothing yet, no resuscitation.
Even the oxygen, you can see the oxygen. Oxygen could be plugged there, but no oxygen. No oxygen. Right now we don't have immunization like hip and hep, polio drops are out of stock. So the kids are suffering.
And in fact, if you look at the number of clinics that we have in the province, we actually do meet the WHO standard now in terms of a clinic per 10,000.
We used to work day and night, but due to shortage of staff, we had to close at 4:30. Okay. Then we don't have the services during the night to close.
But looking at that alone, the number is not sufficient. You have to look at where those clinics are located and how indeed the community is able to get access to these clinics.
I don't take the chronographers and the multi-gravid because we don't have equipment. If somebody can play to them.
Yeah.
But sometimes they come and we take the risk.
Okay.
Two weeks ago, I won't give the lady's name, she lives about a few huts down. Her child was very ill, 1-year-old baby. There's no clinic nearby, and so they walked to the big river, they took a ferry across, they went by, waited for the taxi, went up. By the time they got to the doctor, they went to Elliotdale, the doctor wasn't there, they went to the next doctor, he wasn't there, and the baby died. And we had a funeral here last week, and that was obviously a very sad occasion for the whole village.
mooi, nee. Hartseer.
Looking closely, you will realize that in fact many of our people still have to travel long distances to get to these clinics.
The good story is on Friday, Nofundile, who is a lady who lives in this community, 6 months pregnant, she started fitting really badly. It was a serious case. We called Willems at Madrileni Hospital. He said this is potentially very life-threatening, as all the doctors here probably know, with the baby and all that. We phoned the air ambulance and the helicopter arrived. A balloon, as they call it, came within 20 minutes. And the balloon just landed here, picked up Nofundile with paramedics, got us straight to Nelson Mandela Hospital in Umtata.
We've got a program funded by National Department called the Revitalization Program.
And we got a call yesterday and she's fine. Whoever's responsible for that, and I'm sure Dr. Boyer and your department is responsible somewhere or the other. It's a free service that the government offers to areas remote like this, and we intend to use it a lot. So increase that budget.
We are in discussion with National Treasury to look at ways of funding this program, because it requires a lot of funding for us to be able to. In fact, the estimated funding is about 40 billion rand.
And nothing yet.
They say waiting for the budget. There was a belt tightening last year, so they promised that they bring to this year.
Okay. Thanks.
Otherwise, I'm suffering really.
We are in a process of trying to revitalize our institutions because we feel we are so disadvantaged in terms of everything.
We need the equipment. We don't have any facilities in this place. Even the hospital itself, we need more wards because there's a lot of people who are coming to this hospital.
Through this program, we have managed to renew and build from scratch some of our hospitals which were very dilapidated.
I mean, this hospital, as you can see, is as fancy as anything you'll find in private healthcare, and it's really been well done. And we've got equipment, we're getting the staff, and I mean, yeah, at the moment there's some equipment we still need, but we're definitely working towards making it a well-equipped hospital that's beautiful. And the parts of the hospital that are old, the plans are to upgrade them, to upgrade accommodation, and certainly the service that we offer the community here is going to be fantastic.
Because in terms of that MTS framework, the modernization of tertiary services, we're looking at the entire network of hospitals.
So we don't have any beds. In maternity ward, we are having only 12 beds, and we are conducting maybe 8 deliveries a day.
Particularly the district hospitals and tertiary hospitals, and looking at what sort of a framework that we have to put in place to make sure that we've got the right beds, the right numbers of beds, the right kinds of systems in place to be able to serve the country.
Wi-Fi is not working. It has been stolen. So 5 months ago, not yet paid. So Telkom is charging us.
But because we were talking of a longer term plan which requires a lot of funding, what we decided for this coming financial year is to start the implementation process focusing on very essential equipment that is needed, particularly in district hospitals.
You see brand new equipment, and then we are just waiting for some renovation of things. So
we've got good equipment, we've got good supplies, and yeah, we've got cautery, we've got decent monitors, we've even got an adult ventilator and a neonatal ventilator, but at the moment we're obviously not equipped staff-wise to use those. So.